Here is a detailed drug information guide for octreotide. 1. Basic drug information. Generic name, octreotide. Drug class, somatostatin analog. Drug forms, injection, subcutaneous and intramuscular. Depot formulation, long-acting release LAR. Brand names, sandostatin, sandostatin LR depot. 2. Definition. Octreotide is a synthetic octapeptide that mimics natural somatostatin, a hormone that inhibits the secretion of several other hormones and substances in the body, such as growth hormone, insulin, glucagon, and gastrointestinal peptides. #3. Mechanism of action. Octreotide binds to somatostatin receptors and inhibits growth hormone release, gastrointestinal motility and secretion, pancreatic and intestinal hormone secretion, splanchnic blood flow. This action makes it effective in managing hormonal disorders and symptoms caused by hormone-secreting tumors. 4. Indications. Acromegaly, carcinoid syndrome, to reduce flushing and diarrhea, VIPomas, vasoactive intestinal peptide tumors, esophageal variceal bleeding, off-label, gastrinoma and Zollinger-Ellison syndrome, insulinoma, diabetic diarrhea, dumping syndrome, off-label. 5. Contraindications. Known hypersensitivity to octreotide or a component of the formulation. Use with caution in patients with diabetes mellitus, gallbladder disease, renal or hepatic impairment, bradycardia or other heart rhythm problems. 6. Precautions before taking this medicine. Inform your healthcare provider if you are pregnant or breastfeeding, have diabetes, may affect insulin glucose balance, have liver or kidney disease, have thyroid dysfunction, have heart problems, can cause bradycardia, have a history of gallstones, may require blood monitoring, glucose, thyroid function, liver enzymes. 7. How to use. Short-acting form, given 2 to 4 times a day by subcutaneous injection. Long-acting form, LR, given once every 4 weeks as an intramuscular injection by a healthcare professional. Follow exact instructions as prescribed. Don't self-inject unless trained. 8. Dosing information. Acromegaly, initial 50 to 100 milligrams subcutaneously every 8 hours. Maintenance, 20 to 30 milligrams IM every 4 weeks. Carcinoid tumors and VIPomas, 100 to 600 milligrams per day in divided doses, short-acting. LR, 20 to 30 milligrams IM every 4 weeks. Note, dose adjustments based on response and tolerance. 9. Misdose and overdose. Misdose. Take as soon as remembered unless close to the next dose. Do not double the dose. Overdose symptoms: bradycardia, flushing, abdominal pain, diarrhea. May require supportive care and monitoring. 10. When to stop or avoid taking. Severe allergic reaction, e.g. rash, swelling, difficulty breathing. Severe bradycardia or arrhythmias. Severe gastrointestinal symptoms not tolerable if advised by your healthcare provider due to lab test abnormalities. 11. Side effects in detail. Common side effects: diarrhea or constipation, abdominal pain, nausea, flatulence, injection site pain or swelling. Serious side effects: bradycardia, slow heart rate, gallstones and biliary sludge, hyperglycemia or hypoglycemia, pancreatitis, hypothyroidism, allergic reactions, rash, swelling, itching. NAS 12, vital information. Monitoring required: blood glucose, thyroid function, gallbladder ultrasound, liver enzymes. Storage: keep refrigerated. Allow to reach room temperature before injection. Duration of action: short-acting, 6 to 12 hours, long-acting, steady levels over 4 weeks. 13. Drug interactions. Drugs that may interact with octreotide. Insulin or anti-diabetic medications may require dose adjustments. Beta blockers, additive bradycardia risk. Cyclosporin may reduce its levels. Bromocriptine, octreotide can increase availability. QT prolonging drugs, increased risk of arrhythmias. Cytochrome P450 metabolized drugs may alter liver enzyme activity. Thank you. Have a nice day.